you hear a lot about stress and how stress really affects a couple. And, I often hear it from patients where families are telling, oh, just have a glass of wine and try and everything will be fine, don't worry about it. In Chinese medicine, stress is pretty significant. But from a Western viewpoint, how do you view stress and fertility? Does it really play much of a role?
We think it does, and a lot of our patients are stressed about the process, the fact that they cannot control fertility, and stressed by the amount of times they have to come to our office for various testing and monitoring, and stressed even if they have coverage, sometimes it's an out-of-pocket expense for them, stressed for the amount of time they have to take off from work, and their friends and family are constantly asking them when they're trying to get pregnant. So actually one of the things we like to do is refer to you, because we know that acupuncture helps decrease that stress. And we've had many patients tell us that acupuncture or yoga has helped them. So that is an excellent way for them to cope with their stress. We also have 2 full-time clinical psychologists on staff that only counsel our infertility patients. That is how much we feel that stress can affect fertility. And then, I usually try and see what other things what other lifestyle changes. Perhaps a patient feels that exercise helps release her stress. Perhaps she would like massage therapy or meditation or something else. But stress is very important to the whole process.
I definitely agree with that. I see, especially in the unexplained fertility cases, we look at the stress component in a big way. I believe that Chinese medicine and Western medicine complement each other in a whole host of areas, and stress is a big one. When we work with your patients, many times I view myself as just an aid to assist whatever it is you're doing, just to get the patient relaxed at the very least and mitigate the side effects of the meds that they might be on, during a procedure or whatnot. But to keep the patient relaxed, the couple relaxed, I find is probably the single most important thing any doctor or practitioner can do.
Well, we completely agree with you, and I have told the patients that there are so many areas that acupuncture can help, not just with stress, but also it's supposed to increase blood flow to the uterus and to the ovaries, so we have patients who have decreased ovarian reserve that I think benefit from it, patients who have thin lining when we're trying to stimulate them, patients who after they become pregnant, they have a lot of nausea, and it seems like acupuncture helps their symptoms, patients who overstimulate and feel that they are bloated and have pelvic pain, that it seems to help in a lot of areas. And so, we're very happy to suggest this natural way of them to help them.
So what would you do as an infertility specialist? What specific procedures would a couple come in and have done by you, besides the tests, but actual procedures?
Well, we have a variety of treatment options for the patients depending on exactly what it is that is their problem. So if it's a female problem and she is not ovulating, then most of the time the patient will be getting medications to induce ovulation. So those medications can be in the form of an oral medication, which they take, or an injectable medication to help stimulate their ovaries to ovulate. Now, if they have an anatomic problem, then it is possible that they may have to undergo surgery to determine endometriosis or to treat the endometriosis surgically, or perhaps they have a tubal problem, or they might need in vitro fertilization, which then will bypass the pelvic adhesions and fallopian tube completely and offers excellent pregnancy rates to patients. Now, similarly, if the man has a problem with the sperm, we usually will refer to a male infertility specialist just to make sure that perhaps there's something that can be done for them, either with a medicine or surgical treatment. But if there's not, and the sperm count is very low, then that patient will also benefit from in vitro fertilization, because we can take a single sperm and directly inject it into each egg, and that has a very high success rate for pregnancy.
Do you find that if a man has decreased sperm count, decreased motility, and their morphology isn't quite there, but if you do ICSI from that sample, are the pregnancy rates as good if you do ICSI from a better sample?
Okay, so ICSI is intracytoplasmic sperm injection, and that is where for an IVF procedure, after the eggs have been aspirated and extracted, then they are put together with the sperm, and we would take a single sperm and directly inject it into the egg. So There are situations in which this intracytoplasmic sperm injection must be done. So when the sperm count is extremely low, or if the sperm is coming from the testes or epididymis, or in older women, we are only getting a few eggs, we prefer to take a single sperm and directly inject it into the egg. However, I think if a patient is young and she has tubal disease as her only problem, she may not necessarily need that. So I think it depends on the circumstance, but there are certain situations where it must be done.
Okay. Well, your procedures are obviously a lot different than my procedures. And in our clinic, we do, of course, our primary weapon of choice is acupuncture with needles. And just as you have said, acupuncture has been shown to increase blood flow, increase uterine lining, relax the patient, also normalize stress hormones in the body as well. We also use at our disposal Chinese herbs, either singly or usually in compound formulas. And we never give herbs during an IVF cycle or leading right up to it. We take the patients off it if need be. And we also use diet is a big weapon for us too, and nutraceuticals like different types of vitamins and minerals and whatnot to help activate the patient's reproductive system. In addition to that, we also like to teach them other techniques. As we talked about earlier about stress, we like to talk about emotions and get the patient out and talking about it, not to keep that trapped inside. We also really want to teach them breathing techniques to calm down the sympathetic nervous system, thereby increasing blood flow to the ovaries and uterus, which we find to be helpful, and it's helpful for them to go through this because I also find so many of these patients suffer from some kind of low-lying anxiety disorder, and we want to get them through it as comfortable as possible. And of course, we like to give them a lot of resources and books to go to and websites to go to as well. So, are there any other questions you may have?
I wanted to touch on something you said about the diet and the importance of diet to fertility treatment. You know, we have a number of patients who are overweight, and because of that, their menstrual cycles are not regular. And we find that even a 5% decrease in weight loss can help with menstrual cycles and therefore help with ovulation. So I think that is very important. Additionally, when a patient becomes pregnant, she is going to gain further weight in pregnancy, and if they start out overweight to begin with, they are definitely at risk for gestational diabetes and hypertension and other obstetrical complications. So I think the lifestyle changes that a patient can make with our support and encouragement is extremely important to the success of the process.
Okay, good. And I want to thank everybody for tuning in to our video on understanding fertility and what are some of the treatment options available. And for additional information, you can go to our website at www.easternhealing.org. Thank you and have a good day.